Welcome to the Division of Hematology and Oncology at Tufts Medical Center. We hope that the voices and people that you see and hear give you some idea of how special it is to train here in our field.
I think what makes Tufts special is the people that's here. Obviously, I think the faculty have been all certainly experts in their field. There's a lot to learn from them, but they're also very friendly and approachable, as well as my colleagues. Anywhere from when I started as a first year, all the upper levels are always been very helpful, always been very available to help guide us through every step of the way.
I think our institution has a rich history of dedication to excellent patient care and learning and teaching along the way.
The staff over here is so helpful and everybody's so friendly, be it my co-fellows, attending staff, faculty, administrative staff, nursing. Everyone's really helpful and friendly, and it just makes it fun to come to work every day.
I think the main advantage really is that they get a lot of personalized attention. You're not gonna be lost in a whole group of a lot of other residents. You really get to know people, and you really get personalized attention.
Certainly one of the perks of coming to Boston is that it, as you mentioned, is one of the most diverse centers probably in the country. And I think kind of where we are situated near Chinatown and near the other communities, it allows us to see a very diverse population regularly in the clinic and also in the hospital here. And I think that just allows us to become more culturally competent. I think that's really the name of the game in becoming a well-rounded physician.
The fellows have each other's back, and that we're always there to help out each other when we need it the most.
Tufts had this unique combination of being a program with a lot of tremendous academic resources in a metropolitan center at the heart of academic America, but coupled that with a small, almost familial environment to it. So it's a really unique hybrid of a large academic center with a small family feel that I don't think really has an equal anywhere in the country.
The mission of our division is to care for every patient, learn from every patient, and advance the future for every patient. Our training program is really a unique combination of structure and flexibility that makes sure every fellow gets the kind of rigorous training that they need, as well as the ability to design the experience that works best for them. And we're able, I think, to pull this off because of all of the support and collaboration that exists not only in the division, but in the institution and across the entire Tufts University Health Sciences campus.
I would say that hematology oncology is a great decision. If that's what you want to do as a fellowship, I think the field is extremely dynamic, perhaps the most dynamic one in internal medicine. The need is great in the community and at the world at large. There are many unsolved problems that someone who wants to take this as a profession can tackle.
I hope when I'm here to always integrate upfront or upstream earlier palliative care philosophies as we treat the patient as a whole person, in addition to knowing and focusing on their diagnosis. I've always felt that in caring for patients with cancer, we often need to do more than just cancer-directed therapy. Equally important, I think, is supporting the patient through their cancer treatment experience.
At Tufts, we run a combined malignant hematology and transplant service. I think starting with the first year of fellowship, our fellows have the opportunity to care for those patients, to be directly involved in the management of those patients. I think that's an opportunity that's not available in many institutions, and given that our first year fellowship experience is a whole year long, really gives the fellows an opportunity to follow the trajectory of the transplant experience from initial intake, from decision making regarding who gets a transplant or who wouldn't qualify for transplant, how we choose the appropriate transplant modality for a patient, and then taking them through the preparation, the actual transplant, and then the follow-up afterwards. The modern transplant program has been active over the last 30 years or so. We provide transplant services across the spectrum from pediatrics to adult transplant, from autologous and allogeneic transplants, from unrelated donors, and we're building our program now in gene therapy.
The first year of our program is a real immersion experience for the fellows, almost entirely in the outpatient clinic setting. So they learn firsthand what it's like to be a practicing subspecialist in hematology and oncology. It's a very structured year.
The structure of our fellowship training program is unique in the country, where we place our fellows in full-time experience in the ambulatory setting in the first year, which really allows the fellow to experience the arc of the patient experience through the cancer journey, from presentation and diagnosis, through treatment planning and treatment execution, and then follow-up and survivorship afterwards. And our fellows are directly engaged in the care of these patients.
So we're working with hematologists and oncologists in the clinic setting, which is how we actually practice in real life when we're done training. So that, I think, is a good element that's different than a lot of programs.
Their role is to really kind of understand what outpatient oncology is, and also understand that oncology has gone to this extent that more and more of our patients are not so acutely ill, they're more chronically ill.
It would be hard for anybody to look at this program and see anything other than institution, a division that was built from the ground up to train the next generation of oncologists. I think our clinics, our ward rotations are all very much designed with fellowship training at its heart. So clinics are designed to have fellows as part of the care delivery. The inpatient wards are as well, our consult service. And so very obviously from day one, it feels like we belong here.
The second and third years, by contrast, have some advanced inpatient rotations, but they're really a journey of exploration, both in the clinical experiences that the fellows choose, as well as the research projects that they design and implement and execute, working with their research mentor and their research teams. And that's really where their exploration and their career development and pathway can take off.
One of the specific advantages they have is a very generous allocation of research time. At least 50% of the fellowship is dedicated for research. And secondly, they have a great deal amount of freedom to decide what kind of research they would do across the spectrum of pure clinical research, outcomes or illness narratives, cost effectiveness, to clinical trials, to laboratory-based research, such as the type that I do as well.
In fellowship and here, we have a lot of autonomy, so you're allowed to grow in that way. And once you're more comfortable and further into training, you can kind of do your own thing with the support that you need, which is great.
There's a lot of freedom in choosing what kind of research that you want to pursue, and no matter what project that you're interested in, there are great mentors for finding that and for moving forward with that project. My particular interest is now in GU Oncology, and so I've been complementing my current laboratory work with several projects with my clinical mentor, Dr. Paul Matthew, and I'm hoping to seek a career in genitourinary oncology as an academic career, where I'm do around 50% clinical work and 50% dedicated to research.
The faculty are very invested in educating their fellows in all the different departments, not just the Division of Hematology Oncology, but throughout the organization. And so I think everyone's invested in our learning and giving us an opportunity to pursue whatever career we want to pursue.
We have the opportunity for close interaction, close mentoring with faculty, and development of an independent research project that really allows the fellow to grow and learn in a direction or with a focus that really meets their need and their future aspirations.
I found the mentorship at Tufts to be quite excellent. For me, my mentor is Susan Parsons, who is an expert in adolescent and young adult oncology, which is a personal interest of mine. But I think that overall mentorship is accessible, but also quite seamless. Tufts is a fairly small program actually, so I think it just naturally facilitates these relationships between fellows and faculty, and we work very closely with them in their respective clinics during the first year, and so they get to know us pretty well from a personal and professional sense, and so finding a mentor is quite seamless in that way.
For me, it's always a good thing to be around very intelligent people, especially in this field. There's so much to learn, especially in oncology, where the treatments are always new and very nuanced. So there's, even amongst, very experienced oncologists, there are new things that are coming out that other people may not know of.
Most of the attendings are subspecialized and cover mainly one area, and so they're the specialists in that field. And so you learn a lot and very in-depth from each of them, and I think that's beneficial to us for our education.
I believe that the medical education that I've gotten here has been absolutely amazing, and because we're so close-knit, I feel a lot more comfortable asking questions to faculty whenever something comes up.
I think the faculty here really love working through the life cycle of a fellowship, helping fellows start at the beginning, mentoring them through all of the ups and downs of the learning, and then joining in the celebration at the end, at graduation, when each fellow is invited to present Cancer Center Grand Rounds, using all of the tools that they've learned about structuring a really knock-your-socks-off presentation, and helping them take all the steps they need to make the next transition in their career pathway, and then starting the whole thing all over again with the next class of entering fellows.
The program here has a great work-life balance, even though the first year is a little bit busier than the other years. You still get most weekends off, so the quality of life is typically much better than when we were residents in internal medicine. There's a lot to do. There's lots of GME funded activities that are sponsored that we do as a group with the whole division, with faculty.
I actually really enjoy the close-knit nature that this fellowship provides. I feel like I've gotten to know all of the faculty and all of the other fellows here very well because of how small but close-knit we are, and it really gives more of a sense that we are like a family rather than just colleagues.
Especially in our program, I feel like there is a great work-life balance that you're able to achieve. Most of our first year, experience is based on clinics, and so we usually are here in the mornings, but we get the evenings free. We're on call only for a very few weekends, so I think that gives us a lot of time during the weekends to sort of do things outside of the work.
You're not just working about and doing work or talking about work, but you're talking about life. And so during those moments, you realize and you come to appreciate that you have a lot more in common with your mentors than just being physicians. You're also members of the community, your parents. You have a lot of the same challenges and a lot of the same struggles and joys in life.
And I hope you will consider joining us into our next class.